Hello, I'm Dr. Lisa Balsara from Avinash Cancer Clinic, a pediatric hemato-oncologist. Today we are talking about blood cancers. Before I go to that topic, I just want to clear some concepts. So we will talk about bone marrow first. Bone marrow, in a very simple term, is a tunnel found in our bones. This is basically, in a very layman language, a factory where the blood has been manufactured. Blood consists of three components, which is an RBC, red blood cell, WBC, white blood cell, platelet. Now, RBC's function is to make hemoglobin. Hemoglobin carries oxygen to all our organs and it makes the functionality of the organs smooth. WBC is, the range is 4,000 to 11,000. Basically, it is an army of our body. If we are hit by an infection, the WBC contracts and fights against it, and basically it preserves our immunity. If the WBCs are less, then we are falling sick altogether and our immunity is hampered. But if the WBC is higher, which happens in certain amount of infection, when it's fighting over an infection, to a certain range it is okay. But when the WBC becomes 10 times, 20 times, 100 times, then it is known as immature blasts are being produced in our body, and this is known as blood cancer. And when the blood cancer is there in the body, it hampers the RBC function, platelet function, and the WBC function. Basically, the factory is impaired and we are not producing a normal amount of blood and the quality required for a normal functionality of the blood. This is blood cancer, when in a scientific term is known as leukemia. There are many forms of leukemia, such as acute leukemia and chronic leukemia. Acute and chronic leukemia are further divided by the what kind of cells are being produced, that is a lymphoid series and a myeloid series. So there is something called ALL, AML, CML and CLL, and there are various forms to all this, basically are scientific terms to all this. What are the early signs and symptoms of blood cancer? So blue black spots all over the body, red tiny spots which are known as petechiae all over the body, bleeding through gums, bleeding through nose, unexplained fever for more than 14 days. You have done multiple tests but there is no reason and you are not finding any diagnosis why you are getting this recurrent amount of high grade fevers. You are being tired, dull, you are feeling weak. Suddenly a very active child has become a lazy, very silent child. There is an abdominal swelling, there is an abdominal protrusion, and when you touch the stomach it is hard. There is blood in urine, there is a black color stool. Basically there are the bleeding manifestations produced in all over the body. The very certain signs and symptoms regarding a certain cancers are fever at the night, sweating in the night, halo in the eye, a whitish discoloration of the eye, sudden squint of one eye, irritability, the child is complaining of leg pain, headache, pain in the hands, and all those aches and pains which were not there before. These are the symptoms which the child is giving or a person is giving who is suffering from blood cancer. What all investigations can lead to a diagnosis of blood cancer? A simple test like a complete blood count, a CBC, and a liver function test, a kidney function test, USG abdomen, X-ray. And to confirm the diagnosis, when we have a suspicious of blood cancer, we do a bone marrow aspiration and biopsy. To make it very simple, it is just a 15-minute procedure, but we do it with a complete precaution, or sepsis precaution has been taken. This test will give you the result of what kind of cancer it is. The names which I mentioned before, such as ALL, AML, CML, CLL. Further testing is done on this sample, such as flow cytometry, your cytogenetics and your karyotyping. These are all the genetic, if you have a mutation or not, to find out all that. In certain kind of cancer, we will also do a PET scan if required, but most of the blood cancer do not require a PET scan also. Now, if there are lymph nodes, we will do a lymph node biopsy for the confirmation of the cancer. This is the way a blood cancer is diagnosed. What happens after the blood cancer has been diagnosed? We will go to the treatment option. Mostly all cancer are chemotherapy based regime. What I mean by that is radiation or surgery is not required in blood cancer. Unlike solid organ cancer, we do not grade cancer like grade 2, grade 3, grade 4. Blood cancer, because blood is there in everywhere in the body, it is the second largest organ besides the skin, we grade it like standard risk, intermediate risk and high risk. Irrespective of whatever grade is, mostly blood cancers do very well, that is 80 to 90% of cure rates in almost all type of risk factors. Now, the rule of this 80 to 90% good curable rate is early diagnosis. You do not have to waste any time once there is a suspicious of blood cancer. We will have to be very prompt in diagnosing it and very aggressive in treating it. So, treatment modalities come as a chemotherapy protocol, which means there will be tablet and there will be IV injections given to you in a treatment chemotherapy protocol. It varies over 1, 2, 3, 4 cycle and then the maintenance cycle. When you have completed the cycle and then the bone marrow test will be repeated just to see if you are in remission. Remission means all your cancer cells are not there, it is in a very negligible amount. And once you have the remission, we will go further with the planned chemotherapy. If the remission is not achieved, we go for the higher intensive dose of chemotherapy. Now, all blood cancer do not require a transplant option, but if you are a refractory, means you are not responding to any of the treatment plan suggested, in that case the transplant option will be given. Or you are a relapse, once you are cured and the disease comes back, in that cases the bone marrow transplant is given as a treatment modality. Now, coming to the side effects or the myths of which includes blood cancers are, the first thing which people ask us is, will the hair come back? Yes, all the things which are caused by chemotherapy, once the chemotherapy is stopped, all these things will be coming back to normal slowly. Is it a very costly affair? No, it is not a very costly affair, but if you are from a very low socio-economic background, there are multiple agencies like NGOs, government help, there are a lot of government skill can help you to cure the blood cancer and go through the treatment. There are a lot of medical facilities available for chemotherapy drugs, you just need to approach a medical social worker for all this. And coming to the last line which I will conclude is, if you are suspicious, if you have been told regarding blood cancer, do not delay the treatment in the confusion, because early diagnosis and early treatment are the better prognosis rate. Thank you.